All right, thanks, Amelia. So our first speaker is going to be Dr. Misra, Dr. Sanghamitra M, and she is the medical director of the Texas Children's Mobile Clinic Program, which includes the Super Kids Mobile Clinic, the Ronald McDonald Mobile, and the Texas Children's Care Squad. The mobile clinics are funded by the Texas Children's Hospital with the help from philanthropic donations from the community. Dr. Misra's focus is on immunizations, regular checkups, urgent care, and helping uninsured children obtain access to care, including integrative medicine, including access to health insurance and a medical home. Dr. Misra's clinical and research interests include integrative medicine, immunizations, underserved care, and refugee health. She's active in medical student and resident education. So let's give a warm round of applause. Can I take it off? So God gave me a lot of things, but height was not one of them, so I hate standing behind podiums. So welcome, I'm so glad you guys were able to come, despite it being an election day and everything else that's going on. So I thought I would talk a little bit about bias. I know that Amelia's already introduced the concept a little bit. How many of you have already been to a forum on bias, or like an education session or something, so you feel like you have a pretty good understanding? Most of you. Okay, so I won't dwell too much on the basics, but so what is explicit bias? I think we all know, right? This reflects the attitudes or beliefs that we have at a very conscious level. These are the ones that can be a little bit embarrassing if you're around someone and they're explicitly biased against someone. Okay? They're completely controllable. So that's not what we're talking about here today. We're talking about implicit bias. So bias, this is our bias in our judgment and what we're doing in our behavior. It results in these subtle cognitive processes that often operate at a level below our conscious awareness. And we don't really have a whole lot of control over what's happening in our brains. They are normal, they're natural, and they're often unavoidable processes that are happening. And so there is this subconscious stereotypical assumption that can lead us actually to cognitively classify a patient and impact the way that we treat them, how we interact with them, how we prescribe medicine to them, how we follow up with them. So I know Amelia alluded to this already just a little bit, but implicit bias may be okay at some level, right? So we learn that fire is hot and we create this bias against it because we don't want to be burned. And we learn that eating makes us feel good, so we develop a positive bias towards that. And we are naturally and instinctively biased toward our in-group, which often is either your mother, your father, or people that look like you, and kind of biased against our out-group, so those are mostly usually strangers. So I kind of read a little bit about what psychologists think of implicit bias because, you know, we all kind of know what it is, right? We kind of understand why it happens, maybe. But psychologists truly believe that this happens within the content of our implicit biases are learned from the society in which we live. And from a very early age, we are exposed to all kinds of different things, right? A lot of them are from our own parents, but a lot of them are from media, a lot of them are from school friends. And so all of these things are continuously creating thoughts in our brain and creating ways that we actually process the information that we come across. But over time, these ideas become so ingrained in us that we actually don't think about them very slowly. They're just kind of automatically processed. So what does this mean in medicine? So do physicians have bias against patients? Against other physicians? Against non-physician healthcare providers? So the answer is probably yes to all three of those, right? Unfortunately, but it's true and we know that it happens. So at Baylor College of Medicine, we have an implicit bias workshop for medical students that I have run for many, many years. I'm not running anymore as of this year. But what I learned through that was that, for example, I would have all of the third-year medical students do these IATs together, and then we would break up into small groups and talk about how we felt about the process. And one of the things we learned very early on is that we would never have a non-physician lead the group, because one year I didn't have enough faculty to lead the groups, and I had a nurse practitioner that wanted to lead. And she led that group, and she said it was a very uncomfortable experience because she could tell that the students were actually biased against nurses. And then once they learned that she was a nurse practitioner, because she didn't say it apparently right at the beginning, it totally changed the way they spoke with her. Even though some of the things they were saying were not about nurses, but they felt like they couldn't be very open with her. So through that process, another thing that I learned is that a lot of students don't believe the IAT. So it kind of doesn't matter whether you believe it or you don't believe it. We used it for the students really to just have them start thinking about what bias is and whether or not they have bias, implicit bias on their own, if they're aware of it at all. So how many of you read the Green Cardiology study? This is a really famous study from 2007. That was one of the big kind of landmark studies. And so what they showed was that they did IATs, and what they revealed was that there was this implicit preference favoring whites over blacks, and these were done among cardiologists, okay, all over the country. And implicit stereotypes of black Americans, they implicitly were stereotyped against black Americans because they thought that they were less cooperative with medical procedures. And they kind of felt they were less cooperative generally. And in the end, if you see in the mold at the bottom, whites were up to twice as likely as blacks to receive needed thrombolytic therapy in a time that they were having a myocardial infarction. And they really did, in this study, control for everything, outside of what they considered the bias to be affecting. And I kind of think, I'm a pediatrician, we're not biased. We have cute kids, we take care of cute kids, but it's actually, there's so much evidence that even pediatricians are biased against certain populations. A 2012 study used identical case vignettes to examine how pediatricians' implicit racial attitudes affect how they treated their patients. And as a pediatrician's pro-white implicit bias increased, they were more likely to prescribe painkillers for vignettes with patients that were white compared to black. And this study was redone actually with sickle cell patients, and it was redone with dental procedures, and all of them showed the same thing. If the patient was white, we were more likely to treat their pain. If they were black, they were less likely to get treated. And some people, through the discussions of these papers saying, black people are more resilient and they can handle pain. The threshold of pain is higher. But we all know those are just ridiculous things to say, and that's not actually what's happening. I think we just have a bias against them for whatever reason and not treating them as we should. So just a couple of slides I think I have on the IAT, which is the Implicit Association Test, and how it was created. So in 1995, these social psychologists, Greenwald and Banerjee, proposed the idea that social behavior may not always be under our control. And they argued that much of our behavior is driven by stereotypes and unconsciously. And in 1997, they actually developed this test. And so this is the one you guys just did. So it proposes to measure implicit bias. And what it does is calculates how long it takes you to match a picture or a word to a social group or to a particular characteristic. And so this is their proposal. They say that it takes less time to match a group, word, or image to a characteristic if you already associate that group with the characteristic, right? I just did the one on presidents, right? So they had Obama and good and Trump and bad. And so you can see what they're doing, right? They're trying to get me to click, oh yeah, Barack, good, and I'm going to just click automatically. But characteristics that are not associated with the group are going to take you longer to match, right? Because you're not obviously already biased towards them. So let's focus on weight just for a minute. So weight bias on the part of healthcare providers compromises the quality of care that they receive. And there's been a lot of studies showing this, but physicians actually spend less time with patients that are overweight or obese. And then also, obese patients don't want to come and see us. If I come and see you, you're just going to yell at me and tell me to lose weight, right? So they're not coming as much as they need to come. So when does weight bias start? Does it start in middle school or high school or college or medical school? So we don't know when it starts, but we know that MS1s are already, so first-year medical students are already biased in weight. And MS3s at this one institution, more than half of them had an implicit bias against weight. So over the years at Baylor, we've collected a lot of data because we have these students do these IATs. But we don't link them to a person, so I can't really match up, if it's the men that are more biased or the women that are more biased or what. But I can tell you that every year we've done this, the weight bias has always been there. I think in 2013 it was like 80%. And if you ask students, nobody thinks that they're weight biased. Nobody thinks they're age biased. Age bias is a very common one among medical students. They don't want to take care of the elderly patients. They tend to dismiss what they say. So from 1998 until 2015, over 4.5 million people took the IAT online. And over 200 studies have been published using the IAT. Like I said, there's still some controversy, is it true or not? How many of you have done the same one more than once? Did you always have the same result?
I think I did, but it's changed because the first time I took it was like in college, so that was like, I don't even know, 10 years ago now, yeah. So they've changed over time, but they've been stable, like same direction, but less of a,
right.
Yeah.
Yeah, I've done several of them many times, thinking, oh, this time I'm going to be able to fix it, right?
Yeah.
But I can't seem to fix it. But the IAT also has been shown to be reliable and valid at detecting an individual's level of implicit bias. And as of 2015, from Harvard, over 80% of the people who completed the IAT online had age bias. Demonstrated, this is across. So this is not just physicians, right? So these are anybody that goes online and takes this test. And then about 75% of whites and Asians demonstrated an implicit bias in favor of whites as opposed to whites. So the good news is that implicit biases are malleable. And have y'all heard of debiasing techniques? I don't know if, do you talk about them later? A little bit, okay, good. So actually, I'll just skip this slide because I think you're going to talk about a lot of what this is.